The year was 1981. A mysterious illness emerged, casting a long shadow over the world. It was first detected in seemingly healthy young men, baffling the medical community. This illness, initially known as GRID, or gay-related immune deficiency, quickly earned a terrifying reputation. It was a disease with no cure, a death sentence cloaked in fear and misconception. The media, fueled by a lack of understanding and societal prejudices, further stigmatized the disease. It was labeled the gay plague, ostracizing those affected and hindering early research and prevention efforts. Misinformation spread like wildfire. People whispered about casual contact spreading the disease, fearing even a touch could be lethal. Ignorance bred fear, and fear in turn bred discrimination. The world turned its back on those suffering, further isolating them in their time of need. The truth about AIDS was shrouded in darkness, a darkness that cost countless lives. From the ashes of fear and despair, hope emerged. The tireless efforts of scientists and researchers gradually unveiled the mysteries of AIDS. The culprit was identified, a virus known as HIV, or human immunodeficiency virus. This groundbreaking discovery paved the way for a new era in the fight against AIDS. Scientists worked relentlessly, dedicating their lives to finding a solution. Their perseverance led to the development of antiretroviral therapy, or ART. This revolutionary treatment, first introduced in the mid-1990s, marked a turning point in the AIDS epidemic. ART, while not a cure, proved to be a lifeline. It effectively suppresses the virus, preventing its progression and allowing people living with HIV to lead long, healthy lives. What was once a death sentence transformed into a manageable condition, a testament to the power of scientific progress. While science offered a beacon of hope, a stark reality cast a shadow over this progress. Access to life-saving art remained a privilege enjoyed by the few, not a right afforded to all. Millions across the globe, particularly in poorer regions, were left behind, denied the chance to live. The situation is particularly dire in sub-Saharan Africa, the epicenter of the AIDS pandemic. Here, millions lack access to essential medication due to prohibitive costs and inadequate healthcare infrastructure. The withdrawal of funding by major donors, including recent cuts by the US government, further exacerbates this crisis. The consequences of this disparity are devastating. Without access to treatment, HIV continues to ravage communities, claiming countless lives and leaving behind a legacy of suffering. The fight against AIDS is far from over. It is a fight for equality, for access to essential healthcare for all, regardless of geographical location or economic status. Even today, myths and misconceptions continue to surround HIV/AIDS, perpetuating stigma and hindering prevention efforts. It is crucial to remember that HIV is not transmitted through casual contact. Kissing, sharing utensils, or mosquito bites cannot spread the virus. HIV is primarily transmitted through unprotected sex, sharing needles, or from mother to child during pregnancy or breastfeeding. Knowledge is power. Understanding the facts about HIV transmission is vital to breaking down stigma and preventing new infections. We must also remember that people living with HIV are not defined by their status. With access to treatment and care, they can live long, healthy, and fulfilling lives. Stigma and discrimination are as harmful as the virus itself. Let us move forward with compassion, understanding, and a commitment to ending this epidemic once and for all.